Hi, I'm Dr. Vonda Wright, and this is Hot for Your Health. Join us for conversations on the bleeding edge of science, health, and culture as we bring you tech innovators, thought leaders, and the movers and shakers who are transforming science fiction into your new health reality. Hi, everybody. Welcome to Hot for Your Health. Today's guest is going to take us on a sleep journey that you have never been on before. We have had other sleep scientists, we have had sleep researchers, but Dr. Tara Griffin is a sleep clinician. By training, she is a dentist, and through her own story with sleep difficulty, developed this field and approach to sleep that you probably have never heard of. She is not only a dentist, she is a practice innovator and an entrepreneur and the co-founder of Sleep Solution Centers, one of which is right across the hallway from me in Lake Nona. And so I am so happy to welcome you here today to talk about sleep in general, how it affects midlife people because of how collagen goes away. But honestly, the thing we all deny, but probably do at one time or another, which is, could you please help us sleep in the same room as our spouses again because of the snoring? So, Dr. Griffin, thank you so much for being here today and for telling us first your own story about why a dentist became so profoundly interested in pivoting to sleep science.
Thank you, Vonda. I really appreciate you having me on, and just love what you've been doing in the health and longevity field. And coming from the perspective as a dentist, being a surgeon, I mean, just different type of surgeon than you are, but every day operating on people and restoring things. It's definitely outside of the box from your general dentistry to be practicing sleep medicine, and specifically dental sleep medicine is how it gets categorized now. And there's not a formal specialty around it. So 15 years ago, I was practicing general dentistry. I owned my own practice. I was only about 4 years out of dental school, and I was loving what I was doing. I was really helping impact people and change lives and all of that. But I was suffering with my own problems. And these issues, I was in my early 30s, and these issues had built up really over a lifetime. And the problems that I was having were the typical types of symptoms that most females, young females actually, will suffer with. And these were things like headaches, specifically a lot of head and neck pain, TMJ issues, problems with the jaw, sinus issues, which had been a lifetime for me, and sleep problems started coming on at that time. All of a sudden, I'm waking up at night, going to the bathroom multiple times, which I had never done before. I'd always been a great sleeper, and these chronic pain and issues started settling in. Well, as I started to look for different ways to solve the problem, because I was in so much pain, I couldn't continue to practice dentistry. I mean, it was agonizing. It was exhausting and it was extremely painful. And I thought, there has to be another way. Otherwise, I'm not going to continue to stick with this. And so I started looking at different treatment options, and everything led towards surgery for my jaw and surgery for my sinuses. And the amount of years that I had been on different types of antibiotics and therapies like that to relieve these symptoms, I also had colitis issues. And so the gut, everything was messed up. And owning a business, the stresses of all of that, the practice, all of the life things that everyone goes through. So it was really my own pain and suffering that led me to this field 15 years ago. And I'm very grateful that it did, because I was able to find some solutions for the sleep and for the other pain issues that I was having, and jaw issues and sinus issues. And those are part of what we do today. And really looking at a non-surgical and often non-pharmaceutical way of approaching it. And so addressing more of the root cause. And I never had any idea when those symptoms came on that they would really stem from the underdevelopment and issues that I had as a child because of the growth and development early on that was never addressed until later, exacerbated, once once I was an adult.
Well, as I was reading through some of the information that you state that the nasal airways and sinuses are the main anatomy that interfere with sleep disorders, and that up to 70% of all problems occur within the nose. And so, is that developmental? Is that traumatic? Is that hormonal? What is the root cause, or what are the main root causes of sleep disturbance?
That's a great question. It often is multifactorial, with the nose being a big part of it most of the time. We take a head and neck CT scan in our practice on every patient that comes through from roughly about 5 years old and up. And so we look at the anatomy to see, is there a structural issue going on? Is it deviated septum? Is it more so, turbinates that are enlarged and swollen? Maybe it's an allergic response, allergy, sinus problems. Of course, being in Florida, the allergy capital of the world, it's we have those problems abundantly here. So that is many people in Florida have allergy types problems. And so we look at those types of solutions. And a lot of it is, though, because of poor function. And if you're not able to breathe through your nose, whether it's a structural issue or allergic issue, then you're going to be mouth breathing, which is going to drive up a lot more inflammation throughout the body. So really helping to address the root cause of the nose is one of the biggest things to dive into when we look at our different types of therapies.
So, you have stated publicly and to me that breathing through the nose is critical and it's the basis of your business and approach to patients. But what is so bad about breathing through the mouth? I mean, it is our alternative pathway, right? What is so bad about that?
Yes, and the mouth is the alternative pathway, but that's just it. It is an alternative because nasal breathing, many things are going to be happening. You're going to oxygenate your body better. So especially the brain, getting more oxygen to the brain, as well as the lower third of the lungs. We don't tend to get as much oxygen distribution when we're breathing through our mouth to those specific areas of our body. And also humidifying the air. Okay. Filtering, humidifying, producing nitric oxide, which is very important for cardiovascular effects, regulating blood pressure better and things like that. And that also helps to kill things like fungal and viral and bacterial infections and things that are coming in through our nose. So ideally, the cleaner our nose and sinuses are, and the better we're filtering everything out, the healthier our body is going to be. So it's our first basis of keeping the bad bugs out. We don't do that with our mouth.
That's true. It all comes in. And you know what I've seen trending on social media? People who are going so far as to taping their mouth shut. And so talk to me. I mean, I know nothing about that other than when I see it on social media, I'm like, really? Feel like you're stifling, but what are they trying to get at there? What is that?
Yes, mouth taping. That has definitely become a popular thing to do lately. And I must say, I use mouth tape probably 5 nights a week when I sleep.
Oh,
And yes, I do that myself. But I don't recommend it for everyone. First and foremost, yeah.
turbinates are all messed up. Where are you going to breathe from, right?
Yes, exactly. Because
The right nose.
most people do mouth breathe at least periodically throughout the mouth. And that's another problem is as soon as the mouth opens up, the nose stops working for us. And typically we tend to continue to breathe throughout the mouth the rest of the night. So basically you want to make sure your nose is working well before you tape your mouth shut. And then also how you use tape and what kind of tape and all that stuff. We're not taking a piece of duct tape across across your mouth. And but just a small little piece of medical tape, like less than an inch long, up and down, right across the middle of the lips here, so you can still breathe out the corners of your mouth if you needed to, or that type of thing. But really making sure your nose is working well for you, and you can test this while you're awake. You can put a little piece of tape on and just get comfortable, with that, and promote the nasal breathing. And but I really recommend everyone having a sleep study before you just randomly start taping your mouth shut at night, because if you do have severe sleep apnea, or maybe moderate sleep apnea, or a sleep breathing condition like that, which can be very serious and life threatening, we don't want you taping your mouth shut at night, and especially if your nose is not working. So let's just think that through and be smart.
So when most of us think about a sleep study, we think about where you go into the hospital, you're hooked up to all these things that are pretty unnatural. And then they say, okay, sleep, we're going to watch you. And I've always thought, how in the world are they going to sleep with all this apparatus? What is a modern sleep study? Or maybe that's as modern as we get. Can you educate me, please?
Yes, sleep studies, thankfully, have come a very long way in especially the last 15 years. So that's a wonderful thing. I remember because when I first was going through this process myself, I was taking sleep studies, and one of the recommendations was to take a sleep study in lab, which is the traditional means of testing. And there's the most data, obviously, that we're gathering. We're 30 leads head to toe. We're going, all over our body. And you're right, you're sleeping in a foreign environment. You're being watched by people all night. And it's just not a good, normal situation. And so the trend lately has become, especially in the last decade or more, has become more the biggest thing that we're using these days basically are home studies. And so home studies have come a long way as well too. So now it's as simple today as putting a device on your finger, like a ring, kind of a little different from an Oura ring, but people are familiar with that. So wearing something on your finger while you sleep at night that can sync to an app on your phone and monitor your sleep and breathing. So sleep stages that you're going in and out of at night, much like again, our wearables are doing. And also sleep breathing disorders like sleep apnea, obstructive apnea, central apnea. So it's a game changer today in regards to getting diagnosed. And the beauty of this as well too is that there's studies that simplistic and easy to do at home that are now FDA cleared for children 3 years old and up to be tested at home. So not only for the adults, but for children to be evaluated. And, from there, again, it's a good indicator, even if it's used as a screening mechanism, but it is cleared with the FDA to actually diagnose sleep apnea. But oftentimes, it will be used in that way to determine what might be going on with a child, but easy for kids and adults.
So, if you're wearing a ring or an external monitor, what is being sensed to tell whether it's an obstructive sleep pattern? If are we tracking heart rate? Are we tracking electrical impedance? What's being picked up?
Yes, with certain companies, like the company that we use, Sleep Image, is cardiopulmonary coupling. So they're looking at cardiac, associations with the heart function overall, as well as oxygen levels and pulmonary function. And so again, they're oftentimes when sleep stages, it's more so your paralysis that may be monitored, and same thing with heart rate variability, those types of things, as far as helping determine the difference between a obstructive event versus a central event or a sleep stage.
They must gather all that data and using algorithms, parse it into root causes.
Yes.
So, something you and I talked about when we were first getting introduced that I thought was really interesting is that, a large part of people who listen to me, probably 80%, are midlife women, 35 to 70-year-old women. And uh, everyone, it's not optional, people. Whether you're a man or a woman listening to this, it is not optional. If you have ovaries, they will stop working and you will have your estrogen decline. And one of the things that happens is about a loss of about 30% of your collagen. Now, most of the time that manifests in face wrinkles. And, I'm checking all the time. I have a sentinel wrinkle that I check to see what's going on. But you and I were talking about the fact, something that people don't think about is that collagen is everywhere. And also in the soft palate and the tissues of the throat, which can lead to difficulty sleeping or new onset snoring. So talk to me about this specific portion of the demographic. Because listen, nobody wants to be that snorer in the room, right? Nobody. I mean, no one raises their hand and they're like, let me be the loud one at night.
I know the funny thing is too, when patients come in, we never ask someone if they snore, because 100% of the time they're going to never ask, do you snore? We say, has anyone told you that you snore? Of course. Most people are never going to admit or say that they snore. However, others are going to say that about them. So, yes. And then you also helped me come up with the term, when estrogen walks out the door, snore no more. Same as with collagen. Yes. So collagen affects, so the soft tissue, the soft palate, the tissue that is attached to the roof of your mouth, that when you're swallowing and eating and all of that helps your food go down and not come out of your nose, all that tissue back there, it has collagen. And just like you were saying, as we start losing that, and in our 20s or so, that tissue is going to become more collapsible per se in your airway. And that's what happens with obstructive sleep apnea, is our airway is quote unquote obstructing somewhere. So, from looking from the tip of the nose to the base of the tongue, that's pretty much the view of our CT scan. So we're looking at all these parameters to see where may your airway be collapsing, causing these obstructions to occur. And the nose, we were just talking about, is a major problem for a lot of people. However, the next problem that we see the most frequently after that would probably be the soft palate or the uvula tissue in the back of the throat there. So again, very commonly snoring, the vibration of that tissue. So it can be snoring all of a sudden, early onset of that, say maybe in our 20s or 30s or so. And then it's as that tissue loosens and elongates and stretches out, and it starts to get worse and worse, and then evolving into apnea later for a lot of people. But that's a big area that we assess and evaluate for and look at very closely on our CT scans.
Well, I think it makes it very interesting because we have now talked in this short 20 minutes we've been together about there are congenital reasons that people do not sleep well because of their physical structures, not because of their sleep hygiene, which we talk about a lot, but physical structure. So congenital, it can be traumatic, it can be now soft tissue, hormonally related. So I know in your practice, you've told us you get a CAT scan to look at all the structures, but what do we do about it? What typically do in the sleep solution centers that people might not have the experience with? That's when you use lasers and all kinds of stuff, right?
Yes, we do. So we are an alternative, very comprehensive alternative approach to CPAP and surgery for sleep breathing disorders like obstructive sleep apnea. So we do not use CPAP therapy. However, we believe in it, and there is a place for CPAP therapy, and we have patients that are on CPAPs in combination with some of the other therapies that we're doing. And most of them in time are able to get off of their machines and no longer need them after we go through these different types of therapies. Most of our patients, though, however, can't tolerate a CPAP machine. And so therefore they have tried and or refused to try, but they're not currently using one. So this is really the best alternative here that we have available for that, as well as surgeries. There are some surgical procedures that are done for sleep apnea. They are very invasive. And again, we take that non-surgical approach to be less invasive with what we're doing, and again, be able to help to address root cause and whatnot. So the primary alternative solution that we have for sleep with developmental problems or structural issues are mouthpieces, basically, or oral medical devices is technically what we refer to them as today. So something that can use in your mouth and basically help stabilize your mouth or jaw and help you breathe better at night, so that your airway again is not collapsing, especially around the base of your tongue. So those types of devices, oral devices, actually that are called management devices or like a retainer, they've been around for about 40 years. The CPAP machines have been around about 50 years. And then these mouthpieces or oral devices came out pretty shortly after that because, again, there was always a struggle with the machines, of course, with the nose being the problem. So it's hard to bypass that, blowing air in to something that doesn't work well for you anyway. And so with mouthpieces, there's that traditional way of managing the problem. However, the most groundbreaking thing that we have seen really since sleep became an aspect of medicine the way that it has in the last 50 years and really getting discovered is that for the first time ever, and this was last year, this was actually discovered and finally put into effect and actually approved by the FDA, they're a category of rehabilitative mouthpieces or oral devices that actually are now FDA cleared to treat mild, moderate, and severe obstructive sleep apnea. So this category of device, oral device that you sleep with at night, actually helps to restructure the jaw for you. So instead of retaining and holding and just bringing your jaw forward and helping the bottom part of your airway only, this actually helps to align your jaw, align your teeth, and grow your airway, basically. So it helps address the nasal issues that are a problem. It helps address the behind the jaw and the tongue, really the whole encompassing, approach there. And that actually became cleared not just for adults, but actually for children 6 years old and up. So just this past year, groundbreaking things with the FDA, clearing for the first time any oral device for mild, moderate, and severe obstructive sleep apnea now. The other traditional devices that have been around for 40 years, those were only cleared for mild to moderate sleep apnea because they were more limiting with what they could do, because it didn't address the whole picture. These new Vivos Care devices, they actually address the whole picture. And that therapy is actually the therapy that I did on myself 15 years ago. So I've been using that type of therapy for the last 15 years. Again, kind of orthodontic in nature, aligning jaw, teeth, the jaw joints, all of that. And again, we're very happy that that now it's official and being recognized on a different level.
So how does that work? Does that actually physically widen the palate? It's a device that widens the palate so that there's more room, right?
Exactly. So we think about the mouth and the tongue. And basically, I described this. A colleague of mine actually wrote a wonderful book called 6-Foot Tiger and a 3-Foot Cage. And the Dr. Felix Liao, known him and worked with him for decades now. So the 6-foot tiger is your tongue, one of the strongest muscles in our body. And the 3-foot cage are your upper and lower jaw. So that's where the tongue is trapped in this small jaws, and it has nowhere to go except for back in your airway to cause breathing issues and sleep issues. And so when we make the cage bigger or help expand or grow the jaws, align the teeth better, now the tiger has a bigger cage and it's not as angry and not causing as many problems.
And so does that work in adults? Our growth plates are closed. How do we cause widening of a solid structure?
Yes, that's a great question. So that's a lot of science that is we've actively been researching. I've been part of many clinical trials around this for the last 15 years, actually, and that is part of what has been disproven is the fact that those sutures become fused after a certain age, and we're still taught in school, today that happens, and after 12 or 13 years old. However, with with sutures, their function is to grow bone when signaled correctly. And now with epigenetics, through all the research that's been done, we're learning more and more about how the body responds to different things. And so it's more so with the sutures, they're lined with stem cells. And so when a stem cell is signaled through signal transduction, basically, it gets turned on to continue what it's supposed to be doing. It's like a light switch, you know. So it's once been turned off, now it's turned back on again to signal to finish that template, that DNA, template that we have, and before it was interrupted at some point. And that's exactly what those devices do. So they're passive. They're not worn 24 hours. They're not like braces or clear aligners, and they're not putting a lot of pressure and pain and tension and all of that. It's an intermediate in and out, you wear them roughly about 10 or 12 hours out of a 24-hour period. Primarily while you're sleeping at night. So you're really not wearing them during the day while, you're active and working and speaking. And then your body is really doing the rest of the work while you sleep at night. So yeah, we see a lot of growth and development for adults. And we actually, with our CAT scans, because we're taking all these images, initially when we start, we take a comparison at 12 months and we can see all the changes in bone growth and airway volume and tooth movement. We can see all of this through our technology of our imaging today.
So just in case anybody out there is wondering what sutures? So remember when a baby's born and you're told not to rub their soft spot on their head? It's because the growth plates of the skull are called sutures. It's like little interdigitated bony teeth that are not fused together. And so what you're saying is that those sutures, contrary to popular opinion, actually do not completely fuse, but can be stimulated by pressure to reactivate the stem cells and grow bone again, so that the sutures in the skull and in the head, or these growth plates, we're calling them sutures, that's a cheek stack, can be re-stimulated to widen. But then the question becomes, if we're manipulating bone, the question becomes, what happens to my heart-shaped face and chin? Do I become more rectangular? Or does the external look of a person's face change? And if so, how much?
Yeah, that's a great question. It's subtle. The change is subtle. And especially for adults, it's a pretty subtle change. And actually, I have my before and after photo that I use a lot to share with people. So yes, you'll see some little differences. Like you might notice that the cheekbones are a little more heightened. The corners of the eyes may not be as level or flattened as much. They might be lifted a little bit. It's actually more of like a balanced, youthful look. So as we lose bone volume over time, it's basically some of these procedures with those types of devices are used for cosmetic purposes.
I was going to ask now, has anybody come to say, hey, I want my cheekbones back?
Oh, yes. And it really does. I mean, my before and after photo is different. I wore the device for about 18 months and again, did have a lot of changes there. And so most people, especially too, knowing that we lose bone volume as we get older, we definitely lose it all over our body, but in our face, especially if we lose any teeth whatsoever, then drastically the bone, dissolves and goes away even faster. So helping keep and maintain, good, healthy teeth is extremely important for that. So as we help to stimulate and grow and expand the whole mid part of the face here, it really does help to, basically to beautify and or improve or balance out. So one thing that a lot of people look at for when they think of beauty is balance and symmetry. So that's another unique thing, is the body doesn't just develop equally on both sides. It develops on the side that is underdeveloped to begin with, which for a lot of people tends to be the left side of their face. And I'm still not exactly sure why on that, but more so than not, we see the left side of the face being less developed than the right. There had been things around deliveries and whatnot, because again, you mentioned the bones being so malleable at that age, and how they're being brought out of a birth canal. But, anyway, That's a whole nother story. So the left side typically, though, is the side that's a little more restricted, and naturally we'll just see that start to balance out. So symmetry is something that we start to see more of in that regards.
Well, so let's go down this pathway. You've piqued my interest with the ability to reinvigorate stem cells within the suture or growth plate lines that at every age, and how that's not only therapeutic for sleep, but can be bone changing for cosmetic and for tooth retention. Now listen, I am deep into the longevity and biohacking space, and within that space there is a growing sector of longevity dentistry where, I mean, people don't realize this, but 40% of women will lose teeth in menopause because of the loss of estrogen, loss of jawbone. And suddenly, just like you're fracturing from osteoporosis, your teeth are falling out. So, my friend, you're going to get so much business probably out. Like, where's her office? So, are you saying, or are you saying, could you say, like I am saying, women, you better go get a DEXA scan when you're 40 to see what your bones are doing, because I get lots of really young women, 24-year-old women with poor bone quality. Would there ever be a reason to start thinking about the bone quality in your head? Not only because of your sleeping, but listen, come on, your cosmetics. We need our teeth. Our dental health is critical for 100 and whatever diseases, right?
Yes. Yes. Yeah, absolutely. And that's the thing is, again, just like your, lift heavy, right? I mean, keep those bones, you work those muscles to stabilize the bones, to keep the bones strong as long as possible, to prevent the issues that we see happening, continuously in all of us at some point in time. Same thing as the face is just like the rest of the body. We just don't tend to focus on it as much in that regards. But yes, this is exactly the same, especially with how you're functioning. I mean, they're different, everything from different types of exercises that can be done. So, it really, you have to you really need to start early. I mean, that, like you were saying, get the DEXA scans done, determine what's going on, really evaluate and have this done sooner than later, because the things that women present with, especially, they're not the standard typical of what most physicians are going to be looking for when they're screening for a sleep breathing disorder or an airway disorder. Women do not present the same way as men do. So women get overlooked the most, and then children do as well too, because neither of those demographics present with the same types of symptoms or problems. So the better and the earlier we screen and evaluate and assess for these types of things and do something about it, then yes, the healthier we're going to be longer, the less likely we're going to be losing bone volume and all of that. And then again, the breathing, the function, the sleep, life is good. When you can take care of those things, life is good.
Well, and poor sleep is one of the number one complaints of perimenopause. So 35 to 45 to 50-year-old women. And it's often due to night sweats, brain fog, that kind of thing. But people don't realize that it's due to the loss of collagen. And now, I mean, no wonder there is a longevity dentistry field growing. And when I learned about it just a few weeks ago, I was at a longevity conference in Vegas. I thought, well, are they talking about keeping your teeth? I think what they were probably talking about is all the things you were just talking about, with growth of the palate, stimulating bone formation. And if you can do that with pressure, it's like lifting weights for the bones in your face, frankly, right?
Exactly. Yes. That's exactly what it is. But it's more specified in regards to that. So a lot of people break their teeth or start losing teeth because they might be clenching their teeth at night. They might be grinding their teeth, but especially when they're clenching, they will tend to split their teeth in half. And when you split a tooth in half, you cannot save it. I mean, you're going to have it removed, and then you're going to have to look at options for replacement, possibly implant, something like that. And again, that's where you're going to start to have that bone volume is drastically going to be reduced, and everything when that starts to happen. So that's why we want to look for those signs and symptoms early on, because most people are doing that. Is if you're clenching or grinding your teeth, it is more so than not a struggle to breathe at night. So it's a telltale sign of a sleep problem. Sleep breathing problem is that clenching and or grinding of your teeth. And so teeth cracking when you're going back to your dental checkups and they're saying, hey, you've got a crack in this tooth or a crack in that tooth. And, they're saying, is this normal? Well, it can be, it's common, more so than normal. And so let's evaluate and see why it's happening. Again, let's take a simple sleep study at our home tonight and figure out what's going on.
Well, that's really interesting because my own dentist has pointed out to me that I'm getting cracks in my front teeth. But his approach was, you're a very public person. You might want to do something about that for cosmetic reasons. And yes, okay, I hear that. But I think a more important reason would be because it is a telltale sign of my sleep quality, the bone health in my jawbone, etc. Right?
Yes. Yes.
Yeah. So what age? I mean, if let's say people, well, even if they are, I bet it's not being addressed. They're going to get their teeth cleaned every 6 months. But when should someone make, what age, if they've never done it before, a specific appointment to say what's happening with the bone in my head, what's happening with my sleep? What's the right age if we're on a preventive course?
That's a great question. Because honestly, we treat everyone, and we have different types of. I didn't get into the rest of the therapies. However, as the others are kind of the biggest are oral devices. However, we treat children and adults, and so our thought process is from the day you're born and take your very first breath. That's the first thing you do, is take that first breath of life until the day you die and take your last breath. Your life is really, and your health is really about your next breath and what type of breath that's going to be and how healthy it is, or if you're struggling with it. So really, we assess from the time you're born. At that point, we're looking at things like tissues, tethered tissues, lip ties, tongue ties, things like that, which is a child presenting with restricted tissues like that is literally going to be at a very high risk of failure to thrive, because that's restrictive, tissues that often need to be released. And so those are therapies that we do with one of our lasers, our tongue releases, lip releases, things like that, to get a child breastfeeding well and, nourished and all of that, so they can really thrive. Also, that's going to allow their jaw to develop better. But when their tongue is tied to the bottom of their mouth and restrictive, their upper jaw is never going to develop well. They're going to have nasal breathing problems, and it's just going to go down that road. So really, at any age, you should be assessed. If you've never been assessed, you need to be assessed, because 9 out of 10 children present with sleep breathing issues, but they've never been screened and evaluated and tested, so the parents don't know. So instead, they're being medicated for ADD and ADHD symptoms, outrageous today, unfortunately. That's our other thing, is don't guess, just test. Before you medicate your child for something, especially like an ADD, ADHD type drug, please give them a sleep test first and see better what's going on. But from a preventative adult type age, I mean, honestly, it's today. Today is that you should do that. Oh, today here it goes. Now, yeah, because if you've never had it done, you're already behind schedule. I mean, I was in my early 30s before I figured out, because of the health issues that I was having, I was forced to figure it out, that this linked to me being underdeveloped as a child. I should have had braces. I should have had things early on, or growth and development, something to help address the problem, because I had that classic, like, what we call crossbite, where the teeth aren't aligned in the back, they're not lined up correctly and all of that. And we can address that early on with little ones. I mean, simple little mouthpieces they can sleep in at night, and they do great. They do fantastic. But again, for adults, especially young females, 20, 30 years old, I mean, if you haven't been assessed and you start having the issues of insomnia or anxiety or depression or difficulty swallowing or choking, headaches, all these different things that we get medicated for, then let's evaluate your sleep first and evaluate your airway and your head and neck and just really see better what's going on behind the scenes, because those are the patients that are getting overlooked.
I love that you've summarized it like that because I was reading in your material that we can associate up to 170 diagnoses with poor sleep. And um, I think people are going to learn so much that it's not for dentistry, it's not just about teeth cleaning and braces, right? For sleepopsia, it's just not old guys whose tongues are sliding back with who need CPAP. There's a world of things that you've just taught us, including cosmetic. That's very interesting. But most interesting is the loss of collagen and the way that changes the internal architecture of what's going on. So I just think this is fascinating. I'm just thinking here, you probably told me this 6 months ago when I met you. Okay, I got to get me, my husband, and my daughter to see what's going on with because you know what, as in the progress of my career, obviously a musculoskeletal doctor. I believe in all the pillars of health and aging. And I used to say, oh, it's all about mobility. And then I used to say, okay, nutrition trumps mobility. But I'm telling you for sure, for many years now, I have said if we don't sleep,
Yes.
health matters. And so thank you for creating sleep solutions and all these fascinating things that we've learned about today.
Well, thank you. I greatly appreciate, again, your time and just being able to share with your audience as well, too. And especially being just right beneath your practice here in Lake Nona, Medical City. Yes, so we're neighbors.
We are. And so people listening and watching, actually, the next thing that Dr. Griffin and I are going to do is I'm going to come film in your office. So like people can see exactly what we're talking about. So thank you for being with us today, Dr. Tara Griffin, who is a sleep specialist, a dentist by trade, an innovator, and someone solving so many deep problems we never really realized we had. So thank you for being with us today.
I'm Dr. Vonda Wright. See you next week.